Hello, I'm Michelle and I'm from the Respiratory Specialist team. I'm going to speak to you today about inhalers and why it is important to take these with a lung condition. We're going to look at different types of inhalers and the devices. We're going to talk about what drugs we have in the inhalers and also how to use the devices. We're going to also look at things that might help us to use those devices as well. I'm also briefly going to talk about nebulizers, and we're also going to talk about vaccinations. It's important to understand why you're using an inhaler. The reason that we use inhaled medication rather than taking it in tablet form is because we can actually deliver that medication directly into the lung tissue where it is needed. If we take a tablet, that has to travel around the bloodstream and it also can lead to more side effects, which is what we can get from medications. The most common type of drug that we find in an inhaler are bronchodilator type drugs. These are drugs that work quickly, or also known as short-acting drugs or inhalers. You may be familiar with the blue salbutamol, or otherwise known as Ventolin inhaler. These types of drugs need to be taken regularly and usually work between 4 and 6 hours, or they can be taken as and when required. There are also longer acting type of bronchodilator inhalers, and these work over a longer period of time, usually between 12 and 24 hours. The idea of these drugs are to help keep the airways open for a longer period of time. You can still take the shorter acting bronchodilators in between times. The main purpose of these longer type of bronchodilator therapy drugs is to help reduce symptoms of wheeze and breathlessness, and also to help the airflow in and out of the lungs. Sometimes we can get air that is trapped in the lungs, and this is called hyperinflation. What these drugs do is help to open up the airways so that the air can move in and out much easier. There are also combination inhalers, and these can contain 2 different drugs in the one inhaler. And there is also a triple therapy type inhaler, which is the more newer form of inhaler, and these contain 3 drugs. These combination type inhalers contain 1 type of steroid drug. And if your inhaler has a steroid in it, it's very important that you rinse your mouth after you use your inhaler. This is because sometimes steroid inhalers can cause a hoarse voice or even oral thrush. If you do develop a sore mouth, if you have a white coating on your tongue or white spots, please contact your GP. The triple therapy inhalers are the newest type of inhaler, and they contain 3 different drugs. You may be already on one of these, and they're known as Trimbo, or they can come as a powder form called Trilogy. These combination inhalers mean that you usually only have to take 1 type of preventer inhaler alongside your blue salbutamol inhaler. You're probably wondering how we decide which inhaler is best for you, and this is based on several things. First of all, we look at your symptoms, and this is things such as your wheeze, cough, breathlessness, or how you manage your day-to-day activities. We also look at your exacerbation history, and this is the amount of flare-ups or chest infections you've had of your COPD over the last or previous 12 months. And we also look at how many times you've been into hospital. It is also important that we know if you can properly use the inhaler. This is based on things like your hand strength, your dexterity, and we also look at the strength of your breath, and can you actually get that drug directly into your lung from the device. And using these combination of things, we look at which inhalers may be best for you. If there are several devices that may suit you, then we can leave the last part of this down to your own personal choice. Now we're going to look at how to use inhalers, and we'll look at some of the more common inhalers that we are prescribed. Most people tend to have a blue type, pump type inhaler called salbutamol or Ventolin, which they use regularly or as and when required. This comes with a cap, and it's a pump type device. It's got a canister which needs to be pressed down, and then it delivers a quick blast of a fine mist. As you can see, it comes out very, very quickly, and this can make this inhaler difficult to use. We would strongly encourage that you use your pump or meter dose inhaler with a spacer device. They can come in a tube-like device such as this, or a slightly larger device such as the Volumatic. Either are fine, but what they do, you pop the inhaler into one end, and when you do press it, it slows down the speed of the mist coming out, which makes it much easier for you to breathe into your lungs. We also advise that you do slow, intermittent breathing in and out rather than a long, slow breath in, because sometimes this can be difficult, especially when we're breathless. So when you press the drug into the device, it doesn't go anywhere, it stays contained until you draw out the other end. I'll just demonstrate. So 3 or 4 of those breaths in and out is enough per one dose. This makes it much easier. It's much less effort, and therefore you get more of the drug directly into your lungs, which is what we want. It also helps your inhaler to last longer and stops you having to reorder so often. Sometimes these devices can be difficult due to the strength needed in the hand to activate the canister, and there is aids that can help with this. This is a haler aid, which is a little piece of plastic which can go over the end of the inhaler. Instead of having to do a long press down, you simply have to do a very short squeeze, and then this helps to activate the inhaler. They can also be used alongside the spacer, so this makes things a lot easier. It's especially good if you have arthritis or very poor fine motor movement in your hands. There is another type of commonly used fine mist device called a Respimat, and this contains a long-acting bronchodilator. This is a little bit more technically difficult to use. However, once you get practiced a few times, it's usually quite simple. There is a cap that comes off the bottom, and you have a cartridge. When you first get this device, these come separately. They last for 1 month, and then they need to be renewed. Once you take the cap off, the cartridge goes in the bottom, and you may wish to press on something just to get that cartridge in secure. There's also a space at the bottom that tells you how many doses are left. If you pop the cap back on again, in order to activate the dose, you need to do a half twist. So if you hold the inhaler to the side and do a clockwise turn 180 degrees until you hear a click, the cartridge pops down. You open your lid at the top, and there's a button ready to be activated. This button can be pressed by your finger at the top, or you may prefer to use your thumb and use it at the bottom. Either way is fine. I'll just demonstrate what this looks like before I demonstrate the technique, so you can see what the fine mist is like. So if we press the button, you'll get a long, fine plume of mist that comes out. This also indicates that we need to do a long, slow, steady breath with this type of device. So if I just close the lid, I'll just show you once again how to activate So again, it's a clockwise half twist until you hear a click. We open the lid to the side, and then this is the most important thing about using these type of inhalers. We need to breathe out first before we use inhalers so that we can empty the lungs and get all the air out. This allows us to, when we do activate the device, that we have a full lungful of air to get that drug directly down into the lungs. So just to demonstrate. If you have to take a long, slow breath with any inhaler, it is important also to try and hold your breath at the end. Anywhere between 5 to 10 seconds should be fine. This just allows the drug to settle on the lung before you breathe back out again. This is especially important with steroid type inhalers. And one of these type of devices is the Ellipta, and this is a steroid drug. There's also Symbicort, which comes in powder form, and they're all quite similar. Now with steroid inhalers, you do need much more of a stronger breath and a quicker breath in order to get that steroid powder, the inhaler powder down into your lungs. If I just demonstrate with this, just to give you an example, the lid opens until you hear a click, and again, like I said before, very important to empty your lungs. You pop your lips around the hole, and then it's a big quick breath in. I'm sure you could see the difference between how I breathed in with that one and this one. Also, it's difficult to know whether we have a strong enough breath for these steroid type devices, and we do have things that can help with that. The drug company have produced a whistle test that we can use, and this tests the strength of our breath, and I'll just demonstrate. So if I've got enough breath and strength to get the drug into my lungs, then I will make this have a long, steady whistle sound. So if I breathe out, pop it in my mouth, and a strong breath in, this demonstrates that I'd be able to use this inhaler effectively. If I was unable to make that sound, then my breath is too weak in order to activate the dose. So this is some of the ways that we can test whether the inhalers are actually going to be effective. There are several other little things that may help. For example, if you have trouble with a turning of the inhaler, we can use certain things that may help to do that. But I think the main message here, or the most important thing, is that we need to be able to use our inhalers in order to effectively get the drugs into our lungs where they're needed. If you do have any trouble with any of your inhalers, please speak to your doctor or nurse, and they can look at alternatives. It is really good that we have lots of options now, and usually there is an alternative that we can switch you to. I'd just like to recap some important points about taking your inhalers. It is very important that you have a good technique, and this is to ensure that the medication that you're prescribed is getting down into your lungs so that it can work well and you can remain well. As you can see, there are lots of different inhalers available. So this means if you're unable to take your current inhaler, there may be an alternative. Remember, it's very important that we breathe out properly before taking the inhaler. This ensures that we have a full lungful of air while breathing in our medication. It is also very important, if you take a steroid type inhaler, that you rinse your mouth out afterwards. This helps to maintain good oral hygiene and prevent anything such as oral thrush developing. If you do have any symptoms or a sore mouth, please speak to your GP. You may have heard of a nebulizer, or you may even have had one. This is an air compressor machine, and it can deliver high doses of drugs. They're usually given in liquid form into this chamber, and they can be delivered to produce a fine mist through the mouthpiece or even through a mask. This is usually given to you if you are more unwell and the GP can lend you one for short-term use, or when you come into hospital and your usual inhalers are no longer working effectively. The last thing I'd like to talk about is vaccinations. You may already be familiar with the annual flu vaccination. This is something your GP should be requesting you to have every year. This is usually in autumn or early winter time. It is important that you have these vaccinations. It helps you to prevent serious viral type illness which can affect you more severely because you have a lung disease. You may also have heard of the pneumococcal, which is a type of pneumonia vaccination. This is normally only given once, and it can be given alongside the flu vaccination. This is also something, again, your GP should ask you to have. Thank you for listening. I hope you found this session helpful. If you have any specific questions, please email us on the email provided.